Okay, so really quick on vaccine programs. Again, the core vaccine is CD&T or CND plus T. That we would recommend that for all of your sheep and goats. And usually, typically, we're doing it right before lambing so that the lambs that are born can be protected from not only tetanus, but also that enterotoxemia. Because we can't really vaccinate lambs until they're 3 or 4 weeks of age, because otherwise they just don't really respond to the vaccine. And then they get boosted, the ewes or does get boosted every year kind of at that same time. Other vaccines, because vaccines can be thought of as being expensive, depending on what, the goals, we tend to use them on a risk-based kind of basis. And so, the 8-way is another clostridial vaccine, but we probably would only use that if you have really, problems with liver flukes and might see Black's disease. Foot vax, again, depends on kind of what your environment is and if that's a risk factor for you. Sore mouth, maybe you have, that would be, again, just a risk-based type of vaccine. It's actually a live virus. So you really don't want to use the sore mouth vaccine unless you have sore mouth in your herd or flock. And some of these vaccines are not labeled for the other species. So an example would be like the new Staph aureus vaccine is only labeled for goats, both dairy and meat goats. It's meant to help prevent against Staph aureus, but it also can cross-protect against the coag-negative staph. And so using it in sheep would require a veterinarian, but also would kind of take that liability away from the vaccine producer. So if there are losses, it's not something that you can report to the vaccine producer and try to regain your economic losses from something that wasn't labeled for that animal. So another important thing is vaccine handling. So vaccines are only effective if we keep them that way. So it's important when we're ordering vaccines to make sure it's from a reputable source and that when it's shipped, it's maintained cold. And storage, usually vaccines are kept cold as well, but not too cold. We don't want vaccines to freeze and certainly not too hot. So I have the Goldilocks scenario there. And then they want to be, even when we're administering them, so we take them out of storage and we're giving them to, like this weekend, we want to make sure that we keep them cool. So Dan brings a cooler and we keep the cooler underneath the table if it's really sunny, to make sure that they stay cold while we're even administering it. And then we want to use a clean needle every time we're going into that bottle. So typically most operations are using the same needle until we kind of, maybe it's every 10 animals or whatever that is. But before we refill the syringe, we want to make sure either we're changing needles, so it's a brand new one, or we have a designated needle for that bottle. And then the location of administration is usually in the neck or behind the elbow. And that's just important because of the meat quality and all of that. And vaccines do have withdrawal times. So remember that. Usually they're right around 3 weeks, 3 to 4 weeks. And then again, so leftover vaccines, I saw that question was in the chat. It really depends on the vaccine. So C and D, you can keep in the fridge till you have to do your booster in 3 to 4 weeks. But beyond that, usually they lose efficacy if they're in storage for a really long time. And vaccines that you have to reconstitute. So there are vaccines that come dry and they give you the diluent to mix together and activate it. Those typically lose efficacy within hours after they're reconstituted. So make sure you only mix up what you need and then throw away what you don't use. And then I have a note here for post-vaccination stress. So the animal is now vaccinated, you handled your vaccine perfectly well, and that vaccine is only going to be effective if they can mount an immune response. And if you remembered, some of our diseases tended to come up because of stress. And that's because they tend to be a little bit immune compromised when they have really stressful events. So we want to try to minimize that so their immune system can react to this vaccine we've just given them, so that maybe after we've vaccinated them, we're keeping them in this area, we're not transporting them on a trailer. So those are just some things to keep in mind after vaccines so that they actually get the benefit of what we've just, all the work that has been done. Well, I have a number of slides on parasite control and records, and this has taken way too long.
So let me ask the group. I'm happy to stay if you all are happy to stay. If you need to go at 8 o'clock, we can maybe break now and ask some questions now. But if you're all willing to stick around, we'll get through the rest of these slides. Anybody have any pressing questions that they need to leave right now? Why don't we go ahead, Rosie?
Okay. And like I said, I'll try to PDF these and send them out so you have them as a resource as well. Okay, so we're just going to jump right into control. Parasites, we talked a little bit about coccidia. A lot of these control measures do apply to coccidia, but most of these are really just talking about the nematodes. So that would be like homuncus or ostrich. And so these are the worms that they get in their gut, and they can live in different places in their gut. And in California, we see all of them. So we don't have as big of a problem with homuncus as they do in the South, but the rest of the country seems to think that we don't have the barber pole worm. Well, we do. So we just don't have as big of a problem as the rest of them do. So that said, usually what we talk about with parasite control is refugia. And what refugia is basically just maintaining a portion of that parasite population that is susceptible. And this only applies to parasites, not bacteria. When we talk about antibiotic resistance, that's a totally different thing. So there's different types of refugia. We can maintain a susceptible population within the animal. We can maintain a susceptible population of parasites within the herd. We can think about it as big picture. And then we can even think about the refugia that's out in the pasture. So that gives us a couple of different ways to approach control. So there's targeted therapy, where all the animals within a cohort are treated. And usually we consider this based on a risk assessment about when they're most likely to be heavily parasitized and when, how we want to prevent them from being clinically effective or even contaminating pasture. So this is a targeted approach. You don't maintain as much refugia as if you did, we'll talk about a selective targeted approach. You can see there's a paper that was done in 2013 where they looked at ivermectin efficacy after 5 years. One was just routinely routinely deworming on a kind of monthly, or like in Australia, I believe it was in Scotland. So they'll deworm every 3 months. Versus deworming right before lambing and right at weaning. And so they had a difference of efficacy between 62 and 86% after 5 years. So 86% is still considered resistant to dewormers. So it's not great, but it is better than 62%. So that's just one example of a targeted approach. And some of the risk factors that I kind of mentioned would be, what's the nutritional status of their feed at the moment? Are they weaning and shipping? Certain seasons promote parasite survival, certain environments promote parasite survival. And then again, in the does and ewes at kidding and lambing, they're more likely to be shedding higher numbers. And then stress for, if they're being hauled to shows and events. So these might be periods where you might consider using a targeted approach.
Rosie, can we use white wormers on pregnant ewes or does?
You can use, the only one that you cannot use on pregnant worms is, or pregnant worms, on pregnant ewes and does is albendazole. It causes fetal monsters. It causes mutations in the fetuses.
That's brand name of that active
Valbazin.
ingredient? Valbazin, right?
Yeah.
Okay.
Yeah.
Thank you.
Yes. Thanks for that question. Okay, and then we might think about environments that we're in and what their feeding behavior might be. So if they're feeding really close to the ground, if maybe they're patch grazing because it's really hot, and so they're all grazing under the few shade trees that are in the pasture, they might be higher risk during those times. And then, you know, what their water source is, where they're kind of all congregating. So targeted selected therapy would still be using a targeted approach, but you're only deworming high risk individuals within that target period. So you could use fecal egg counts, you could use indicators like FAMACHA or 5-point check we'll talk about, or you could use performance-based. And so average daily gain would be one. So if you're weighing animals, that would be one way to know. The challenge with that is that there's genetic differences. And so Scotland, a group in Scotland actually developed the happy factor, which they call it the happy factor, but it basically is a calculation that looks at whether it was a single or a twin or larger group, looks at what type of pasture it was on. So there's different variables that they put in that help kind of come up with this scale and to decide whether or not this animal is high risk. So FAMACHA, pretty simple. Again, something that you might do every time you have that window of opportunity to get better practice at it. True FAMACHA, you have to be certified for, and there are courses to become certified at doing FAMACHA. They give you this card that you can, a lot of people will like punch holes in it and tie it around their wrist so that it's kind of easy in there when you're going through these animals. Usually, so you'll start by checking 10% of the herd, and if you don't have any 4s or 5s, so 4s or 5s are the really pale and then the like basically white animals, then you can kind of go from there, and that kind of helps you decide whether or not you're going to treat the 3s. The 3s are the ones where you're kind of like, I don't really know what to do with these guys. They're kind of on the fence. If you have a lot of 4 or 5s, then you might treat your 3s because you're getting ahead of what may in a week or two be a 4 or 5. So it's one of the challenges with the FAMACHA is only a snapshot of where you are right now. So really to do a good job with FAMACHA, we're doing it every 3 to 4 weeks to make sure that we're not missing individuals that maybe we just didn't catch the right time point of their infection. So another way to decide if you're treating 3s is if they are close to lambing or kidding, if they're really young, or if you can't check them again in 3 to 4 weeks. One of the challenges with FAMACHA is it's targeted towards the homunculus worm or the barber pole worm, which is, it sucks whole blood. But some of the worms that we have, and like coccidia is a good example, is that they don't suck whole blood. They actually take proteins. And so there's you're not going to see that anemia. So this 5-point check was developed to help kind of consider more parasites than just that one worm. So you're looking at nose for nasal discharge. We really only see bots here in the fall, but that might be something that we look at pre-breeding. We'll look at the eye and do the FAMACHA, looking at the jaw for swelling. So that would be protein loss. That would be an indicator of parasites would be one cause of that protein loss, not. And then looking at body condition, and then also looking at fecal soiling or DAG score. And all of those things together might help us decide whether or not we're going to treat the animal. A little note about combination therapy. I think there's some folks that are starting to use this, which is great. Is it really can improve treatment outcomes even when you have resistant parasites in a herd. So you'll see on this table, there's some examples. If they're resistant to drug 1 by they're only 80% of those worms are susceptible, and even drug 2, only 80%. You combine those 2 drugs, you get 96% efficacy, and that's considered susceptible. And then even as you get lower, like 60% really resistant population of worms, but we combine that with a drug that is that those worms are susceptible to, you get really effective treatment. The key with this is that you have to use targeted selective therapy with this. Otherwise, we're going to get multi-drug resistant parasites. So there was this study that was done in Australia, and not only did it slow the development of resistance, it actually reverted this worm population to susceptible. So really exciting, but really important to remember that if we are using a combination approach, we want to use a selective approach. And might even make sense because, as you can imagine, you're buying 2 drugs, so it's going to be more expensive. So you might not want to be deworming your entire herd or flock anyway. So that might motivate you to use a more selective approach.
Rosie, there are no products approved for topical application for internal parasites for sheep, are there?
No, and not goats neither. Okay. Their skin is so different. So I know folks will try to do it, but it doesn't absorb the same way. So basically what we're doing is we're exposing parasites to a lower drug concentration, which promotes resistance. Yeah, good question. Okay, so alternative strategies. Some of these can be combined with dewormers and help kind of with that kind of combination approach. So there's condensed tannins have been shown to be really effective at helping to minimize coccidia and effective against some of these nematodes. So short term, we can reduce egg counts, and if it's fed long term, you can actually kill adult worms. One of the challenges with like Sericea lestedisa, there's a lot of research on that. That is I believe it's just a weed that grows in the South that cattle producers hate because cows won't eat it, but goats love it. It's very high in protein, which is good because usually condensed tannins bind that protein. But long term, it can cause molybdenum and cobalt deficiencies. So these should be something that we consider feeding kind of in a, like, again, a targeted approach. So we don't want to be feeding them all year long. Okay, and then copper oxide wire particles are another approach. They're really specific to barber pole worms for some reason. They think that it affects the lining of that worm, or like the cuticle, which is kind of like the skin. And so it can affect those worms for 14 days. And then long term, you still get copper absorption. So you wouldn't want to re-treat these animals for 6 to 12 months, depending on what the copper status is in your area or your herd. So there's different doses for ewes versus goats. It's 1 to 2 grams for ewes versus 2 to 4 grams for goats. Goats are a lot more tolerant to copper than ewes are, or sheep. And in the dwarf breeds, we're going to limit that to 2 grams. And again, because we can it only has that 2-week duration of efficacy, but we can't redo it. We want to make sure that we're really targeting this for high risk periods. Okay, so avoiding copper in feed. It is really important to know what your copper status is in your feed. There are certain pastures that have copper levels that are really high, but there are also flocks that are deficient in copper, and copper is really important for proper immune function, for kind of skin health, gut health. So it is an essential micronutrient. It's just we can't feed it in sheep at the same level that we can feed it in horses, cattle, and goats. So that's why when we say, look for a mineral block or loose minerals, we want to make sure that they're kind of made specifically for sheep because they'll be at a lower level, whereas copper supplements for other species tend to be much higher, and sheep can't tolerate that. So they do need copper. We just need to be aware of how much they're getting, especially for supplementing. Okay, so there is a vaccine called WireVax that's available in Australia, New Zealand, and the UK. It is not available in the US at the moment. There are researchers in, I believe, Louisiana that are, or it might be Auburn in Alabama, that are looking at developing this here. But basically, it targets an antigen that's in the intestinal lining of the worm. And so chances of this worm becoming resistant to this vaccine are really, really slim. One of the challenges with this vaccine is it has to be given 3 times in this high-risk grazing period, 3 weeks apart. So it's not necessarily a really inexpensive way to control parasites, but in situations where we really don't have a lot of other options, it could be really effective and important for our industry. And then ways to minimize exposure. So this can be done a number of different ways. Folks talk about alternative species rotational grazing. So this might be where you have cattle follow sheep or poultry follow sheep. Sheep and goats share parasites, so that wouldn't necessarily work as far as impacting parasite control, other than coccidia. But basically, the parasite that they ingest will go into their digestive tract and won't be able to complete its life cycle. So it won't be able to reproduce, and it'll come out the other end unviable. So it'll basically help kind of clean up your pasture a little bit and minimize, kind of help reduce pasture contamination. We can provide browse for goats, and that kind of gets them eating up off of the ground a little bit, or feeding, if we're using feeders, feeding them off the ground so they're not exposed to contaminated areas as much. And removing manure can help, because remember that those eggs are shed in the manure. Pasture management is another way to try to minimize exposure. We can have these clean pastures they talk about. It really depends on the season. So some of these parasites die at freezing temperatures. Some are really hardy, like Cryptosporidium is really hardy and can survive a lot of different temperatures. Most of these parasites will die at temperatures over 100, 106 degrees. So if we're in really warm environments, that can actually help. So when we think about clean pastures, we're thinking about the period after that really warm time. So they say, oh yeah, we need 3 to 6 months to clean a pasture. It really just depends on the kind of what events are happening in that time period. And if that's even possible to do for a lot of folks. That's not even possible to breast a pasture for that long. And then once you've cleaned the pasture, it only takes 30 to 40 days for that clean pasture to be kind of recontaminated again. So other ways to manage pastures is by manage animals in pastures is by strip grazing, or kind of like high density grazing over shorter periods of time. And so if we keep that time period to 3 to 4 days, then they're not, what they're ingesting isn't infective. So it's really not infective until that kind of, 4 to 7, and in some parasites 10 to 14 days. And then there's rotational grazing, again, potentially resting pastures if possible. Again, for most people, that's really not possible, but leaving this residual is what's really helpful. So when they're eating to the ground, that's when they're exposed to the fecal matter. And in homunculus, the larval stages are actually mobile, and they kind of wiggle up these grasses. So that's what this kind of graph is showing, is how far the larvae are able to get up. And so there's really few larvae above 10 centimeters, which is 4 inches in height. So if you can maintain a residual of 4 inches, then that's really good, not only for pasture health, but also for animal health. as far as herd improvement, we kind of mentioned that there are genetics in our animals that are more resistant to disease. There are animals that are also resilient to disease. So that just means that the host or the animal is able to handle an infection. They still shed eggs, but they don't show clinical signs. So when you're doing your FAMACHA test, they're not going to show that they're effective or affected by this parasite, but they'll still shed eggs, if that makes sense. Resistance is where that animal is actually to mount an immune response and kill those parasites, and they won't have any eggs in their manure. So resistance is a pretty moderately heritable trait, which is kind of exciting, whereas resilience is less heritable. Lost my mouse. Here we go. Okay, so when we're thinking about this with fecal egg count, estimated transmittability, or estimated breeding values, or depending on the industry, whatever acronym we use, the immune system the function is determined both by genetics, but also environmental factors. So that's why it has kind of a moderate heritability. And then, so we can look at fecal egg counts to help kind of make our breeding decisions. We can look at treatment records and only cull animals that are receiving the most treatment, so have higher FAMACHA scores. It really only works with a targeted selective approach because you can differentiate those animals that are affected or not. And then we can just decide to cull all of our high scoring FAMACHAs. These kind of targeted approaches not only improve herd genetics, but they can also help reduce pasture contamination, because usually those animals that are highly affected are the ones that are actually contaminating the pastures. So when we think about which of these is actually going to promote more resistance than resilience, it's actually the fecal egg count test, because you're actually looking at whether they're actually able to kill the adult parasites. Okay, really quickly, just briefly go over records and why they're so important. We kind of talked about it a little bit with our parasite resistance, but it also applies to disease resistance in general. Okay, so with records, we want to make sure that they're accurate and accessible. We want to make sure that they're simple and easy to understand. So especially if we're keeping paper records, we want to make sure that we're really just focusing on what we need to achieve our goals. If we keep paper records on everything, I don't know who's going to go back and look through all those and make a report. So without recording and evaluating our kind of production goals, it really comes down to guesswork, and kind of good recommendations can't be made with any kind of confidence. So it's really important to measure the outcomes that we're interested in. Targets should be based on goals, and if you have a business partner, it should be something that is agreeable to both sides, and be sure that this target is economically realistic. So we want to make sure that it's something that can be achieved in short term and doesn't require a lot of inputs that aren't going to be realized in the end as outcomes. And then, is there an industry standard? So are there guidelines that we can follow that can help us achieve these goals? Or we kind of talked about benchmarks. So are there industry benchmarks? If not, what are we seeing in our area, or what are our neighbors experiencing? So these can be really helpful when we're kind of recognizing where we're at and what our potential production goals could be. So again, really important to make sure that we convert what we've captured into useful information. So this can either be lists, it can be graphical, it can be numerical, they can be tallies. Anything that helps us visualize this data is really important. I always keep this, remember the denominator. So a good example is, okay, well, we haven't had that many abortions this year. We talked about 3% across your herd. Well, what if that 3% was just in your first time lambers, then it might actually be a higher percentage within that cohort of animals. So it is important to kind of know where your numbers are coming from, because it might just bring up a red flag and help you kind of go down that investigative path. And then as far as running statistics, if you are doing anything that's a little bit more challenging, there are programs that can help run those. There are websites that can help run those. And then sometimes your extension can help you with those as well. Okay, so reports, usually, for example, when you're working with your veterinarian, it's good to get reports from those events that happen on those kind of annual basis. If they're coming for pregnancy scans or they're coming for breeding soundness exams, those are good opportunities to really look at what your percentages are, what your conception rates and things like that. And it's important to get those and keep those so you can monitor those over time. It's important to keep an updated animal inventory list for a number of reasons. And again, keeping those so that you can look at them over time. It's great to see where you're at right now, but it's also really neat to kind of see where you've come or how far you've come. Okay, and then treatment records. So for one, they're often required because a lot of our treatments are extra label drug use, and we have to keep a record of that. Well, veterinarians do anyway. And it's important to know what your withdrawal times are and which animals, and then as far as the benefits of being able to identify animals that, like we talked about, require repeat deworming. If we want to look at flock health and really recognize which diseases are an actual problem or which are kind of just sporadic, these type of records help us recognize those trends.
And Rosie, we keep some of those records right on the animal. So if we treat with antibiotics, they get a red mark, and we note the date that red mark was applied, and that allows us to track withdrawals and things like that.
Yeah. And I know some folks are using different ear markings for culls and things like that, and that's great. Part of, I guess, what I think would be helpful is knowing why, like why she got an antibiotic, why we decided to cull, because that might help us identify what the actual problem is. And then, if it gets to a certain level, then we, a threshold where we decide, okay, now we need to really focus on this and look at a control or a prevention program. Cool. Well, that's pretty much what I have. And then just a list of some resources. There's a sheep production handbook that we're working on. A few chapters should come out soon. But there are other, like ASI has a sheep production handbook. Langston University has their dairy goat production handbook. They have a meat goat production handbook. They're really helpful. Your mentors are really helpful. And then your local veterinarian. And then, of course, cooperative extension. So that's all I have.